Hello and welcome to About the House. A large number of health conditions can be classified as chronic disease. Some can be immediately life-threatening and others can persist over time and require intensive management. The Standing Committee on Health is holding an inquiry into chronic disease prevention and management in primary health care in Australia. I recently spoke with Committee Chair Steve Irons about the cost, not only to sufferers, but to the taxpayer.
Primary health costs in Australia is over 50 billion. And that's without all the on-costs as well. That's just primary health costs in Australia. So it's an enormous amount of money that goes from the government's budget into health. We think it'll be a fairly long inquiry because we plan to get as much information as possible. The areas that we need to look at, we'll probably go to every state and we'll go to some regional areas as well, because one of the big things that we've found in previous inquiries, not related to chronic health but to all other areas of disease as well, in regional areas it's just as prevalent, and there's usually a lack of resources and infrastructure for assistance to people in regional areas, so it's important we cover that as well. So it will be a far and wide-ranging inquiry, and we look forward to getting industry people and people who are actually experiencing chronic disease and seeing what we can see as a committee to make recommendations to the government. So the Minister's particularly highlighted the area of preventive chronic disease management, so that's something we'll be looking at closely as well. The GPs, if we can give them information so that they can have notification or are able to detect onset of early chronic disease issues within a patient, it'll be hopefully make it a better management for that particular patient or for all patients, and that's part of the desire of the committee, is to I guess extract that information out of the industry so that we can make recommendations to the Minister. And I guess it's also about getting an efficient system which is better outcomes for patients and better outcomes for the Australian taxpayer.
For more information on the committee's inquiry, see the website.